All right, good to have you with us as we head up to 9 minutes to 7 o'clock. All right, managing our health over the last 2 years has been a bit tricky, hasn't it? Or the slightest hint of a headache or a sore throat, of course, has been a concern for many of us. But here's one of the important questions we're asking at the moment. In the middle of this Omicron variant, this highly transmissible Omicron variant, if you've got a bit of a sniffle or a cough, do you go running off for a COVID-19 test? I'll tell you why we're asking the question. They're quite expensive, aren't they? Unless you're lucky enough to be on medical aid. But even then, it starts getting costly for your medical savings account. So at what point do we don the mask and go running off for another test? SA Medical Association's Dr. Mvuyisi Mzukwa joining us. Doctor, good to have you with us. So let's answer that question. Shall we runny nose, sore throat, a bit of a cough? Do we have COVID-19? Should we run off to get an earbud stuck up our nose?
Good morning to you, Gareth, to Dumelo and your crew and viewers. Thank you for having me in your program. You will remember, Gareth, that there's a very thin line between the common flu and the COVID-19 symptoms. So especially with the Omicron, the early data shows that symptoms might be mild. You might not show any severe, scary symptoms. So that's why it's important to test, because the problem if you're not doing the test, you're going to go out and spread the virus to other people. You might even infect those that are vulnerable with underlying medical conditions. So it's important not only for yourself, but to protect the people around you, including your family and the community at large.
But I suppose the problem is, Doctor, we put this question up on social media. A lot of people saying that you might not have all the symptoms. I'm just looking for basically free medical advice here at this point, Doctor. You may not have a sore throat, a runny nose, and red eyes. You might just have some hay fever, which is causing you to perhaps sneeze quite a lot. At that point, Doctor, do you avoid going out? Do you self-isolate, or do you go for a COVID-19 test? I'm sure you agree that it is quite a grey area, isn't it?
I fully agree with you, but we are in the middle of a pandemic. We need to make sure that we do not have the COVID-19. It should be a diagnosis by exclusion, that of a hay fever and stuff like that. So, there are cheaper tests now, there are rapid tests, and also government institutions, if you don't have medical aid and you don't have money. But it's important that you test, because you don't know how that condition is going to progress if you don't test, and also the risk of spreading it to other people.
What happens to those who are asymptomatic? Another question that I saw on Twitter this morning ahead of our discussion, Doctor. So they've perhaps had a slightly runny nose, a bit of a cough. They've gone for a test. They actually do have COVID-19, but now they're asymptomatic as well. They've recovered, but then they end up getting a cough and red eyes again later. I'm just trying to get a better sense of at what point do you not leave the house? Or are you cautioning, Dr. Mzukwa, that even if you feel like you may just have a simple sore throat, to avoid everybody and anything and stay inside? Is that what you're saying?
Well, I think if you did test and you were asymptomatic, but you're still positive, we've got that time that you need to spend in-house or in isolation for about 10 to 14 days, sitting, protecting other people from getting the infection. After that, chances are that you still have, we have not seen really reinfection immediately when you get COVID. You would just continue with whatever treatment you're using at that time. You don't have to go retest again. So the issue is, if you have not tested and you find that you are symptomatic, honestly, no matter how mild those symptoms may look like, you need to make sure that it's not COVID-19. I've made an example of this Omicron. Some of the patients, I remember in the third wave, they just came in with fatigue, fatigue, nothing else. I had a couple who had attended a funeral with no other upper respiratory tract symptoms, just fatigue. And we just understood at that time that we're in the middle of a pandemic. We do them a test, and the test came positive. So don't take lightly whatever symptoms you have until it has been proven otherwise. I think that's my advice.
And perhaps just before I let you go, Doctor, briefly, if you could, I'm sure you understand how difficult it is for those as well who are still employed. Luckily, if they are employed, they've got bosses that they have to report to. I suppose we all can't just call in sick as well every time we've got a sore throat or red eyes or a runny nose, can we? I mean, there's a reality that we have to deal with as far as employment is concerned. Our bosses are going to get very upset if every time we have a sore throat, we call in sick and go for a COVID test. It starts getting taken advantage of, doesn't it? Very briefly.
Fortunately, that's where we are, Gareth. I mean, if a person is sick and symptomatic, they obviously need medical attention. Unfortunately, that person, have to discuss if that person consults with the doctor. They've got to decide if they are higher risk of having COVID-19. But I mean, to just be upset because the employee didn't come to work because of sickness, I think it's rather upset. I would expect that employers by now would understand that we're trying our best, to isolate those who are symptomatic so that we avoid the spread of this virus. Because if you allow that person to come to work, say that person is positive and infects the whole crew at work, so you've got nothing at the end of the day if everybody is infected. So rather sacrifice one person.
All right, Dr. Mzukwa, thank you very much indeed. Hopefully employees and employers listening. It's a tricky time, isn't it? So, how careful should you be? Is there a point now in the fourth wave with Omicron where we are being overly cautious? Is there such a thing during a pandemic? Clearly, that is not the case.